Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. Today we are exploring sleep with Dr. Yishan Xu from the California area, and I'm very honored to have her on. She is a truly incredible woman, a licensed clinical psychologist. She's a founder and director of the Mind and Body Garden Psychology Incorporation, and she is the first board certified Chinese English bilingual behavioral sleep medicine specialist in the United States. It's a lot of words there. She's incredible, and she was trained at the Stanford Sleep Medicine Department. I'm very honored to have her on here. And she also has a podcast called Deep into Sleep, which she was very kind enough to have me on to share how we can use breathing to help with sleep. But more than that, I'm so honored to have you on, Dr. Yishan. Thank you so much for joining us.
Thank you for having me. It's an honor to be here.
Can you share with us a little bit about how you got into sleep and what was your journey to this?
Yeah, it started actually very just out of curiosity. I finished the whole doctoral training in clinical psychologist, and I got my license to practice. But then when I searched for training opportunities for postdoc, I realized, oh, there's something called sleep medicine. I never got any formal training in sleep after all these years of clinical training. And then, so after I got my license, I was lucky enough to get into a Stanford Medicine Center to really get some part-time training in sleep medicine. So it really started with my curiosity. But then once I started learning that, I realized actually I do have a long history of sleep disorders within my family. After learning more in that department, learning more from other doctors, I realized, wow, my dad has severe sleep apnea. At the beginning, I just realized, oh, he snores. I thought it's normal for all these years. And then I realized, oh, it's not normal. So after a lot of those training and journey, I start getting to know more about sleep for my family, for myself. And then I just got more and more passionate in this field.
That's wonderful. And it's great. And then, so now when you work with clients, you have, besides helping them anyone with mental and emotional disorders, you can help them with sleep, because I imagine there's a very close connection between how well you sleep and how well you can process things mentally and emotionally, right?
Yeah, I actually think after I start learning sleep, I realized it could be a very great gateway to reduce people's mental health stigma. You can start from treating people's sleep disorders, help them sleep better, and then help them realize or understand maybe underneath that there's some anxiety, depression, or other mental health issues. It's challenging, and they can look into that further. So a lot of people can accept that better after they get some treatment of sleep.
That's great, because I can imagine, I mean, when you're sleep deprived, you can't really make great decisions anyways. And hearing something about your mental health probably isn't as receptive if you are sleep deprived and you're cranky and you don't even want to hear it. So I can see how getting you some sleep can shift you to allow you to accept, okay, there is still something wrong that I need some help with.
Yeah, sleep definitely is a part of the healing journey for a lot of things.
Right. So can we go through the sleep basics, the cycles that we hear, deep sleep, REM sleep? Can you just kind of touch base on what does a sleep cycle look like in the middle of the night?
Yeah, so a lot of people actually thought, oh, what's a typical standard healthy sleep is you go to bed, you fall asleep immediately, quickly, and then you wake up, it's bright and sunshiny in the morning. That's possibly a good night of sleep. Not really. A lot's happening when we are asleep. So the typical sleep stage, the research has been changing, but typically it has 5 different stages. So stage 1, 2, light stage of sleep. Stage 3 and 4, that's the deeper, like we call deep sleep, deeper stage of sleep, and then REM sleep. So what happened is when we fall asleep, we actually go through stage 1 to the light stage of sleep, and quickly, very quickly, we rotate into the deep sleep. But then we rotate in and back out to light stage of sleep and back into the deep stage sleep and back. So several rounds of that at the first half night. That is most when the deep sleep happens. And then the second half of the night, our sleep stage change. We start have more REM.
Okay.
So we left deep stage, we go back to light stage, we go back to like REM, and then wakening, REM, wakening, some light stage of sleep. Occasionally a little bit deep sleep may happen, but mostly it's REM, the second part of the night. That's part of the reason why a lot of people can remember their dreams when they wake up.
Got it. So people who stay up till 1 or 2 in the morning, do they basically lose out on deep sleep and only get some REM sleep?
Not really. So our sleep stage is whenever you fall asleep, you're gonna have to go through this stage. Yeah, but if you don't sleep enough, definitely you won't get through the whole percentage of the stage that is your body needs. And of course, then I'm gonna cause something. So depends on what happened, what we eat, what we take, what happened around our schedule. Sometimes our deep sleep may be suppressed. Sometimes our REM sleep may be suppressed. We may not get enough of those.
Okay. And so, and during the REM sleep is kind of when we're processing stuff, right? Is that when we have the dreams and processing?
So I would say every stage has its own healthy benefit. It's a little bit complicated, and I think there are a lot of research cannot figure out exactly what's happening. But I think deep sleep, for example, it's for us to release growth hormone. So that's the stage for children to grow their body, their brain. So that's make them taller, right? That's important for children. They have a lot more deep sleep. But for REM sleep, for most people, it's our brain process emotional memories, emotional informations, and in a way of dreaming, they are processing this emotion. So that's closely related to emotions.
Okay. Now, some people remember dreams, some people don't. Is that a problem? Is that okay? What's kind of a standard protocol for dreams or not remembering dreams?
Yeah, I would say it's totally okay. Does not matter you remember or not, because dream can be so different. Some people, their dreams has color. Some people's dream don't have color. So it's fine. There's no clear evidence out there saying you remember your dream versus you don't remember your dream can indicate your sleep quality is what. There's no such evidence. So a lot of time I think it's people's own interpretation cause some anxiety, saying, oh, I remember my dream, so I must have slept poorly. That's not true.
Okay. And I didn't even touch on this with you beforehand, but I'm curious with nightmares, if you have any insight into nightmares and what do they mean, or is it we're processing, just kind of your thoughts on that?
Yeah, actually in my Deep Into Sleep podcast, I had one episode talking about nightmares because I read some really great research papers. So for nightmares, there are a lot of research from VA hospital to study veterans when they come back from from the war zone. And a lot of times the nightmares is our brain trying to recreate a scenario to teach ourselves how to survive better next time through this horrible scene. So again, it's some kind of emotional processing. It's somehow our brains trying to increase our survival rate in the future and try to understand those emotions. But nightmare can be very, very horrible, very unsettling, and there is a very specific treatment method for it. And the most evidence-based, I think, is called IRT, imagery rehearsal therapy. Some sleep psychologists, very experts in this area, they just treat nightmares. So there's definitely a way to do that.
Oh, that's good to hear that there's some relief, because it really affects you. And I mean, we've all had some kind of nightmares, and you wake up in the morning and you can tell your hormones have shifted because you've experienced this traumatic nightmare, and then you're cranky for the morning or whatever. So I, it's a good to have a solution to it.
Yeah, if it's a occasional nightmare, I don't think we all need to worry. We all possibly have that. But if it's repeated, it's very bothering you, then there's certain treatment for that.
Yeah, that makes sense. What are some other common myths that people think of related to sleep that you constantly have to dispel?
Yeah, so I talked to my professor who trained me in Stanford, Dr. Barwick. I actually interviewed her just talking about sleep myths a long time ago. So there's some typical ones in my clinical work, since in my clinical practice, I treat insomnia most of the time. So a lot of people, when we cannot sleep well, we have all these anxieties, all these thoughts, because we think of sleep differently, and social media and sometimes talk about wrong information. For example, we think if we should all have more deep sleep. For example, we just like people are worried about dreaming, people somehow think deep sleep is good. I know some Apple Watch or whatever kind of trackers will tell you, and people always focus on how much deep sleep I get. And when they come to see me, they said, oh, I did not get enough deep sleep. There's a problem. But the reality is they all have certain percentage. And deep sleep every night, a healthy adult's sleep, deep sleep's percentage actually is lower than REM sleep.
Oh.
Yeah, a healthy adult every night, we should have around 20% of time spending in REM sleep. But only possibly 15% around that is deep sleep. Sometimes even lower than that. So, and it's really depends on how long you've been asleep, right? Because your body tries to get through all this sleep stage within a certain period that you are sleeping. So like some people, they only get 1 hour deep sleep. It's not necessarily something wrong. Maybe that's just how their sleep structure is, depends. So if you only, you are someone sleep only 5 or 6 hours every day, you can just imagine, right? How much deep sleep you're gonna get, how much REM sleep you're gonna get. So I think that's a typical myth. People always think about, oh, deep sleep. A related one is the sleep hours. People somehow have this idea like, I want to control my sleep. I want to monitor my sleep. Then how many hours did I sleep? What this means? Does that mean I am sleeping not good, right? Something wrong with me? But not everyone needs 7 or 8 hours sleep. So even though most doctors would say, oh, typically 7 to 8, yes, typically means about 50% of people, or maybe a little bit more than that. But then there are quite a large percentage of people need a variety of hours. Their body just cannot generate 7 to 8 hours. Some people, some people naturally, they just can generate 5 to 6 hours. If you force them to sleep 8 hours, you're gonna create insomnia. So some people just cannot. Some people, their body naturally need to sleep 9 or more hours. So it's really like sleep is such an individualized thing. So it's different from person to person.
Do you have people basically test themselves, like say on a weekend, have someone go to sleep and just see what they naturally wake up, and then have them do that for a couple days in a row and see kind of where they land? Is that a way to test? Because I mean, I don't even know what my sleep need is at all.
Yeah, I think that's the problem with our modern society, right? We have things in our lives. So weekend may not be a good time, since a lot of people accumulate sleep debt during the weekdays and they try to make it up during the weekend. But however, we cannot really make up our sleep debts that much, not as much as people think. But the best way, I think, is when we are on vacation. Sometimes I ask people, well, if you are on vacation, if there's no, certain plans where every morning when you have to get up, where you have to go, then maybe, and that's the time when we are calm, relaxed, you can really go to bed anytime you want, you can get up anytime you want, then that's possibly a good time for you to try to monitor your sleep for several days. A lot of time that makes sense to people when I ask them, right, when you go to vacation, what's your sleep schedule? And then I get a more, sometimes very different sleep schedule. And when people really pay attention to that, think about that, then we all somewhat know our sleep need. Even though it's not very clearly, we somehow know better.
Yeah, that's true. And I have to say, growing up, I was very a high achieving person, and I kind of got into the thought of, I'll sleep when I die. I'm gonna push, 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 and not very healthy. I mean, I pushed the limits. I was up all night, studying, and not healthy. And it wasn't until I got into my 30s that I started really shifting and putting high value on sleep and becoming more aware of my health is determined by my sleep. And I'm curious if that is part of your education with people, is stressing the importance of sleep and the tie with health.
Definitely. Depends on what people come in with. Everyone come in with different sleep problems, different health concerns. Actually, a lot of people come in for me to want me to treat their insomnia. Their concern is maybe this gonna negatively impact their health. So they have motivation to treat it. But this is only one group. The other group commonly I see is either teenagers, their parents got really worried about their sleep schedule, or young professionals. They work so hard, they are so stressful, they cannot sleep very well. Sometimes it's very clearly they are not prioritizing their sleep. And their sleep schedule got messed up. They don't know what to do, and they got anxious. They got stuck. So it's very typical. And I would say I always teach people there are some difference between sleep and health. Like based on the sleep problems. If you have insomnia, the anxiety sometimes is too high and is unnecessarily biased. Because from our clinical practice and a lot of research show, if you have insomnia, that means even if you give yourself opportunity to sleep, right, you are not able to sleep. It's not you can force it or control it. And then for insomnia, more and more recent research showing it actually does not directly link to severe health consequences, not so bad as people imagined. So a lot of time people got so panicked about insomnia. We notice people with insomnia for a long period of time, like 10 years, 20 years, 30 years, they can still function very well. They are suffering for sure, can be better, but they can still functioning, they can still keep their job, their health is fine. But what is more severely impact our health is sleep deprivation. These two are different. Sleep deprivation is you don't give yourself opportunity to sleep, but actually your body is able to sleep. So that's the major problem. I think that's a bigger problem. That's what relate to a lot more health consequence, much more than insomnia. So I think nowadays a lot of people's problem is not care about sleep. They care about anything else in life. If there's anything pop up, sleep is the first thing to go, first thing to sacrifice. I think that's a bigger problem for everyone.
Yeah, and I can understand that, and especially with the social media and everything, the blue screens or blue light that we have on all of our screens. And can you touch base on that and why the blue light matters? A lot of people think, oh, it's just a myth, it doesn't matter. So can you touch on that?
Yeah, so that's part of the education when I treat insomnia, actually. I would say it's not, I would say there are two aspects of the blue lights of the electronic device. So the blue light, it's a type of light directly, work on our eyes, and because behind our eyes, it directly connects to our brain center, which controls the sleep. So blue lights actually go through our eyes, working our brain. It blocks the release of melatonin. And melatonin is something everybody release naturally in the evening time to prepare ourselves to sleep. It gets our body and brain ready, saying, oh, it's dark, say it's dark. So now we are releasing melatonin and we slowly get sleepy, then we are ready to sleep. But the blue light kind of like make our eye and brain does not recognize the darkness anymore. Blue light or the too bright light in general, it just use, especially blue light, it blocks that. It just could delay our bedtime, delay our feeling of, sleepy, feeling of tired, feeling of wanting to sleep. But that's only one aspect. I think what the device where the blue light come from cause another problem, because most time it come from some kind of electronic device, right? Yep. And if it's a device we are watching, means we are watching some content, and the content directly stimulate our brain. So if we are watching a show, we are watching even some news, we are talking to people, we get excited. Yeah. We also could get emotional. It could be harsh conversation. It could be a scary news. Like last year, a lot of people could not sleep well because they read too much COVID news. So it's, and later it could be the political news. It's just everyone's trigger point is different. I think this emotional trigger gonna make your brain too awake. It directly triggers our sympathetic system, and then you are like in this fight or flight stage. Then how can you be relaxed and try to sleep? You cannot.
Yeah, that makes sense. And I can see how it shifts us. And now certain devices, I know like on my iPhone, there's a setting that reduces blue light. So I think at a certain time in the evening, it turns off the blue light aspect and everything changes to like yellowish color. Same thing with my laptop. And I know I've seen also screens or some kind of device you can put on top of the screen that does it. Is that good enough? Well,
yeah, for blue light itself, some of those are good enough. Okay. For example, clinically, we do recommend the amber glass. Sometimes you can wear while you are using computer. I think it's similar thing. I don't know how different device the blue light filter are they work the same, some possibly better than others. I don't know for sure, but that normally could work for the blue light aspect. But that does not solve the other problem for the emotional trigger.
Right. And that's something that we almost need to become our own protector of what we take in the evenings. And I know I don't look at news in the evenings. It's the only time I look at the news is early in the morning, because that's the only time that I'm going to check and get emotional about stuff. So I can understand what you're saying about that. So another question about caffeine. So modern society, so many people drink coffee early in the morning, drink tea, have a caffeine hit. Okay, what can you tell us about caffeine and sleep?
Yeah, so we need to know a little bit about mechanism of caffeine. So caffeine is something, it actually does not directly make our brain get energetic and excited. Caffeine actually block our sensation of the tiredness and sleepiness. Okay. Your body, if you don't sleep well, you don't rest well, you still could be very sleepy and tired. But by drinking coffee, it blocks that signal from being received by the brain. So that does not, give you extra energy, but you can hang on there, you can keep on working. And for caffeine, I would say really depends on everyone, how sensitive you are to it. Some people more sensitive than others, because caffeine actually has a very long half-life. The half-life of caffeine is 4 to 7 hours. So from the time you drink it to the time it totally get out of your system, it could take up to 14 hours.
Oh, wow.
Yeah, that's why for me, I am very sensitive to caffeine. So I learned my lesson through practice, through my own difficulties. So I learned not to drink any caffeine or at least coffee or tea in the afternoon. So basically past noon, I don't drink any caffeine. I know that's going to impact me dramatically, but I also know some people are okay with it. So I would say understand your body and go from there. There are some more recent years research saying caffeine, this impact to our sleep is not that dramatic. It's not as bad as nicotine and other things. But I think for people who are sensitive to caffeine, it still could be quite bad. Also, one thing to be careful about is caffeine has this withdrawal effect.
Okay.
So a lot of people with insomnia, when they come in to seek my treatment, they already tried so many things. And one thing is definitely stop caffeine. But the problem is if you're a heavy coffee drinker, you suddenly stop caffeine because you cannot sleep well, then you are experiencing both insomnia and caffeine withdrawal.
Oof.
So a lot of people are going to have this harsh headache and they feel awful and they cannot sleep well and they are afraid, they cannot drink coffee. They're just suddenly they are changing too many things in their life, and the gut is really hard.
Yeah, and I can imagine there probably is some aspect of anxiety very closely tied to insomnia. And when you have that anxiety kicking in, and then you tie it with, I'm afraid I can't sleep, I can't sleep, I can't sleep. And then it's like, it just goes into a spiral. I can see how that can get out of hand.
Yeah, that's why the right now the most recognized, most evidence-based treatment for insomnia called cognitive behavioral therapy for insomnia, CBTI. What it does is not only help you adjust your sleep habits, sleep behaviors. There's heavy component in the treatment is to change how we think, how we rethink about sleep, how we rethink about other things related to sleep to really reduce our sleep-related anxieties. And this method is very similar to the method when we treat anxiety, because the most evidence-based, one of the most evidence-based treatment for anxiety is also CBT, but it just not for insomnia, it just standard CBT.
Right.
Yeah, it's definitely connected. Does not mean you definitely have anxiety when you have insomnia, but when you have insomnia, normally we have some anxious thoughts about sleep.
That's interesting. So, and I imagine when you're doing the CBTI, you're not looking at any sleep medications, right? Do you try to avoid them or do you sometimes use them? What are your thoughts on sleep meds?
Yeah, so CBTI, this method is delivered by sleep psychologist. I'm a sleep psychologist, so I don't prescribe medication, but a lot of insomnia patients, when they come to me for this treatment, they are already taking medication. They are on medication. They are taking, sometimes they are taking quite a lot of different type of medication for sleep. So normally in the course of this 4-week treatment, people will be able to reduce their medication use, or even some people can stop it. Like today, I just received an email from a previous group member follow up with me, telling me, oh, she's doing better. She now is stopping her medication, which is she's stopping first, which is she's stopping second. So I get all these follow-ups from people knowing they are continue with what they learned. They are happy because why we take medication is because we don't have other methods to help with sleep. We don't know how to sleep better. We tried many things, does not work, the medication. So the treatment, the goal is to really replace the method, give you more coping strategies, give you more knowledge and method how you can sleep, how you can change your sleep. When people are more empowered by it, when people have more, methods they think they can use and they try, they somehow work, then they don't have to rely on medication that much. So they slowly, very typically, people can slowly reduce medication. Nowadays, even a lot of sleep doctors who prescribe sleep medication, if they know sleep medicine is field very well, many of them will not prescribe sleep medication. They will refer people to CBTI treatment first. Say, if that treatment does not work, then come back for medication.
Yeah. Because I mean, I would imagine there's other side effects too. If, medications unfortunately don't come without side effects. So it's always great to try to avoid it as much as possible.
Yeah, we do teach people, we do educate some basic side effects of sleep. That's really to what you just asked me earlier about the sleep stage. Actually, a lot of sleep medication will suppress our deep sleep, suppress our REM sleep. So it makes our sleep quality a little bit bad.
Okay. And I'm curious too, because some people are kind of considered night owls and other people are morning, birds. What can you tell us about just what, are people oriented differently? What does that look like for people?
Yeah, I actually get quite a lot of young professionals because I live in San Francisco Bay Area. So a lot of young professionals here sleep very late, work very late, sleep late, and go to work late in the morning. Many of them have this anxiety, think something wrong with them, why they sleep so late. So they are trying to sleep early. That's typical, right? We think you should go to bed early, and that's healthy, especially for Chinese. And then, but what happened is they cannot fall asleep if they go to bed early. They try, they cannot, and then they stuck. So actually, when we go to bed, it's decided by our genes. At least 50% decided by our genes. So naturally, people are divided into at least 3 different type of chronotypes. So there are early birds. Those are really early. They may feel sleepy at 8 or 9 p.m. They just cannot do much anymore. They need to go to bed that early, but they can get up like 3 or 4 a.m. They are like ready to go, so bright and sunshiny and great. But typically about 50% are in the middle part, right? Like go to bed around 11, 12, get up at like 7-ish, 8-ish, and feels great. But there are also some percentage of us are night owls. Night owls, naturally, they just very creative at night, very energetic at night, but they just cannot feel sleepy at all until maybe 3 or 4 a.m. And they won't be able to wake up until noon. That's very typical and standard night owl. There are also people like a little bit in between of this, right? There's a spectrum. So if genetically you are like that, then of course, if you want to shift it, you cannot just say, today I decide I'm gonna shift my bedtime by 3 hours. That won't work. It won't work like that. But a lot of people try that. So cause a problem like insomnia. A lot of time when I realize they are night owls, I tell them it's okay for you to sleep late. Your work allows, you can totally sleep late, get up late, because that way when you are awake, you are at your peak of your creativity, your productivity, it works better. If you force yourself sleep early, get up early, then the whole morning may not work for you. You are trying to work, but you're not productive, and you then feel guilty and all that. So a lot of people just by that, they cure their so-called insomnia. They don't have problems anymore. They got the permission to sleep late. I don't remember whether I mentioned this, but I sometimes teach my patients, insomnia patients, about this research. I think 23andMe is right at Bay Area. They publish their studies when they do the genetic test for people. They did find some evidence support this, genetic determination of our chronotypes as well.
Okay, wow. And does our sleep need change over time as we get older?
We do. That's another thing. I think our sleep naturally do change as we age, not only as we get older, from children to teen, to teenage years, to adult, to young adult, to older adult. It's all change. Every stage is slightly different. So our expectation to sleep need to change accordingly. If we always want to sleep the same as maybe 10 years ago, sometimes that causes problem. So
Okay.
there are quite a lot of research and charts. Sometimes I will show my patients how sleep change as we age, what's
Mhm.
happening, what to expect, how to adjust our perceptions. So it's definitely changing.
So as an older adult, someone who's in the 60s or 70s, would you expect that they have less need to sleep? Or do they sleep more because, like, if they're retired versus not retired?
Yeah, so I think from their sleep structure, from the science
Mhm.
that they just have more weakenings at night. It's not like they need more sleep. I think older adults, their sleep just gets more fragmented.
Okay.
I think that's common for them to have more awakenings at night.
Mhm.
But actually, surprisingly, a lot of older adults are more satisfied with their sleep than
Okay.
younger adults. um, so so it depends how they perceive their sleep. If they can accept, okay, my sleep now is like this, they are fine, may not be problem. But regarding what the sleep look like when they retire or not, I think the problem is the sleep habit. We see a lot of retired older adults start napping more,
Mhm.
not going out much. Not last year, definitely COVID is not
Yeah.
helping. But overall, not a lot of activity, a lot more time in the household, no work anymore, no structure anymore. So they tend to nap more. But when you nap more during the day, it's gonna hurt your sleep drive at night. Then make people have a harder time to feel sleepy at night or be able to stay asleep for long, right? So when you already have a little bit fragmented sleep and then you have a low sleep drive, you can
Mhm.
imagine what the sleep gonna look like. But then most people focus on the night sleep. If the night sleep does not feel good, then they feel even worse. They're even more worried. They want to rest more during the day,
Mhm.
and then that impact the night sleep again. So it's a very negative loop.
Okay. So do you recommend that people don't nap at all then?
I not like that, not that black and white, depend on
Okay.
specific situation, but general guideline, I would say I would recommend take a shorter nap.
Okay.
Um,
Okay.
Normally less than 40 minutes, 30 or 40 minutes,
Okay.
no more than that, because you don't want go into deep sleep during a nap. Normally when we fall asleep within 30 or 40 minutes, we will go into deep sleep. And then if you wake up from that, you will feel so drowsy, so awful.
Got it. That makes sense. I appreciate that. And I'm just also curious, as we get into an adulthood, we tend to get up more to go to the bathroom at night. And, sometimes even older adults get up even more. Do, does getting up to go to the bathroom and in the middle of the night more than once, is that hugely impactful on our sleep cycle, and or is it something that our body can just adjust to and we can still get the same quality of sleep?
This actually relates to another sleep myth we haven't talked about is
Mhm.
actually every healthy adults, we do wake up on average 12 times or more per night. We just
Wow.
sometimes don't really get up to use restroom. We wake up, we fall back
Mhm.
to sleep right there. We don't even remember, but it's very typical and healthy to wake up in the middle of the night. So if I would say if we wake up and end up using the restroom and going back, we can still fall back asleep quickly. No problem at all. It's very common. And of course, if you want to use restroom, you should use the restroom, right? So it
Mhm.
just for older adults, I think there's a fall risk. They have to be careful.
Yeah.
And sometimes for some people, when they wake up using restroom, take harder time to go back to sleep. And
Mhm.
depends on the situation that possibly need a little bit intervention. And there's another thing is if we use restroom too much, sometimes that could also relate to other sleep disorders.
Okay.
Yeah, certain sleep disorders involves, frequent bathroom usage at night.
Oh, wow. So it could be a sign of another sleep disorder, basically.
Yeah, so sleep is so complicated. I treat insomnia mostly, but there are about 80, around 80 different sleep disorders out there.
Oh,
Insomnia is
oh my gosh.
the 80.
Wow. Is insomnia the most common sleep disorder?
One of the most common.
One of them.
Yeah,
Okay.
there are many other common ones. Mhm.
Okay. Oh, wonderful. So I'm curious, there's this big fad now, the Aura Ring that's out there. And oh, I think every single one of my friend has one right now. And they tell me in the mornings what their sleep pattern was. And I'm curious what your thought is on something like the Aura Ring and how, if you've examined it to know if it's accurate. So curious on your thoughts.
Yeah, so personally, I haven't used it, but I
Okay.
definitely heard my friends and some clients are using it. But
Yep.
I would say I cannot directly comment on Orin like specifically since I don't
Mhm.
have direct experience with it, but I can comment on sleep trackers
Yeah.
overall in general. At
Mhm.
least so far, based on what I heard in Stanford, my colleagues, other doctors, we don't think there's any trackers, sleep trackers on the market that is able to have a super accurate track of the sleep. Nothing could compare to a sleep study in a
Yeah.
sleep center, right? Where all these
Right.
players sleep one night in the sleep lab and got monitored. No single tracker can do that. They
Yeah.
just miss a lot of things. So the problem is because the data is collected through those kind of technology is limited, sometimes they are a little bit biased. So it can, for people who are very healthy oriented, sometimes it's a good monitor. But if for people who really want to control sleep and want to make sure their sleep goes certain way, basically they make sleep a performance. Those
Mhm.
kind of trackers, including our rain, I think gonna make this sleep performance worse. So
Okay.
I talked to a very famous sleep doctor from UK a
Mhm.
long time ago. So we talk about sleep trackers in general, and he mentioned this newer type of insomnia we call orthosomnia. It's caused by the new technology, these new trackers, because people they possibly sleep fine, but they track their sleep every morning, every night. They want to know the data, they want to change the data, and they will try to adjust their sleep accordingly. That type of performance anxiety and the sense of control actually end up causing very bad insomnia, and that is caused by this new technology. A lot of people misunderstand the data, just like we talked about earlier. They don't understand what that means. I have 1 hour deep sleep versus, I have 2 hours of deep sleep. People think, oh, that's bad, then I have to do something. The sleep is so individual, so it's
Yeah.
different. You have 1 hour deep sleep, possibly it's good for you, versus your friend has 2 hour deep sleep, possibly good for them. So I think that's misunderstanding, misinterpretation of the data, and not quite understand what your body needs exactly could potentially cause more problem. So yeah, I think it's useful for some people, but have to be cautious for other people.
Yeah, no, that makes sense. I really appreciate your thoughts on all of that. So any other kind of tips that you would recommend to people? Say, hey, okay, I want to maximize getting some good sleep. What are just maybe a couple tips that you would recommend to
Mhm.
listeners?
Yeah, there are actually quite a lot of things people can do. I think
Yeah.
the most important one is to keep a consistent wake up time.
Okay.
Sometimes it may not be reasonable or realistic for people to always go to bed at a certain time. So I would say no matter how late or how early you end up sleeping on a certain day, always keep a consistent wake up time.
Okay.
Set up alarm somehow, always get up the same time with the same routine. weekdays and weekend, try to keep them consistent as well. That help us anchor our circadian rhythm, reset it all
Okay.
at the same time in the morning. And
Okay.
that can help us overall improve our sleep quality if we keep on doing that. So I think that's probably one of the most important. And other things people possibly can already know from many online articles, and I always try to tell people, it's this morning sunlight. So the recent research saying we need about 15 minutes of natural sunlight exposure to eyes. But
Okay.
some people think, oh, I am just at my home through glass, I can see the sunshine, right? That should be.
Mm-hmm.
But there's a recent research showing if you are staying behind the glass, the natural sunlight exposure actually is cut by 50%.
Oh, wow.
It's better you can go out
Okay.
a little bit. That would be a little bit better.
Okay.
And another thing related to what we talked about earlier, when people have trouble prioritizing sleep, right? I would say there's so many people work until the moment they go to bed. Even sometimes I do that, but my brain got too excited. So I would encourage everyone to try to set a buffer time before bedtime,
Okay.
like half an hour to 1 hour. You put down your work from no work to try to sleep. This
Yeah.
middle part is a buffer to help your body and brain relax and transit from a busy day into a quiet sleep state. Our brain cannot just shut down like that. We need a time to do some routine, to do some relaxation, to do some wind down.
Yes.
Really start, slow down everything and build up this sleepiness. Or sometimes it's not build up, it's to help us realize, oh, actually I'm sleepy. Or else
Yeah.
brain so fired up, it does not recognize any signals our body keep on sending. I'm tired.
Yeah.
But we are not getting it, right? So
Yeah.
this wind down, this buffer time, I think can be very helpful for people.
Yeah. Yeah. No, I really appreciate it. All those tips are phenomenal and definitely brought to my attention some of the things I need to keep in mind. So I thank you so much for your time today and sharing all this great information with us. I really appreciate having you on.
Thank you for having me. It's great. I always love to talk about sleep.
Oh, good. I am glad to hear that. You did a great job and so much information. I know people are going to take a lot away from this and they can start implementing things right away.
Yeah. So definitely people, I have a lot of this, what we talk about in my podcast already, Deep into Sleep.
Yeah.
I also just launched the CBTI treatment group in Chinese online. So it's an online course and with live Q&A with me every week. So I hope more people through your show can know about CBT for insomnia, this method, find the local providers for that. If they speak Chinese, they can check out my Chinese version of the treatment as well.
That's wonderful. And how can people reach you the best? How can people get a hold of you?
Yeah, people can just email me at yishan@mindbodygarden.com.
Okay.
They can just go to my clinic's website, mindbodygarden.com, or
Okay.
check out my podcast website. I have my information email there as well, deepintosleep.co.
Oh, love that. And I love that you are helping the Chinese community too to fix a lot of the insomnia issues because different cultures have different ideas about sleep and you're addressing something dear to your heart. And if people out here know someone who's suffering from insomnia who needs some help, hopefully they will come to your website and send people your way because it's an important thing. It affects our health and you're doing great work.
Thank you. Yeah, I really hope to help more people as well.
Wonderful. Well, thank you so much for joining us today. Everyone, thank you so much for joining us. Have a wonderful rest of your day. Take care, and we'll see you again next weekend. Bye.
Bye.